Hi, my name is Leslie Lee and I'm the owner of Aesthetic Creator, and today we're going to talk about dermal fillers. Everyone that I see typically for their first time is super nervous about getting dermal fillers. And what they are is it's something that your body naturally produces called hyaluronic acid, and so it is kind of formulated into different regimens basically. Like you have your Juvederm products, which are cross-linked, you have your Restylane products, which are more particle-based, and then there's a variety of other ones on the market. You have RHA and you have Sculptra. There's just a bunch of different dermal fillers that we utilize in our practices. One of the things that I like to tell patients is that by the time we're 30, we've lost a whole teaspoon of volume in our face. So that means that we start to age in our 20s, right? Like we have our peak muscle mass between the ages of 20 and 25. So as we lose that volume, we start to look more tired. We start to feel more tired, like we look like that. And so when we look in the mirror, we're like, oh man, I just don't feel like I quite look like myself. Or I'm starting to feel the age that's reflected in the mirror. So we use dermal fillers to actually help replace volume and kind of restore what's lost. So when you think about that, we think about the cheek. If we pick the cheek back up, that will actually help the nasolabial fold and the marionette lines. So this is the foundation of your face. Kind of think of it like you're just, like this is the structure, kind of the base. And then we can come back through, once we get this lifted, that will make your under eye look better, your nasolabial fold look better, and actually your jawline look better, because we all know we start to get those jowls. So we can actually do a little bit on the jawline, and then we can do a little bit in the cheek, and that will also help pull this area. The nasolabial fold is actually the second place that people look at their face. So number one, when we're talking to someone, we usually look straight on at their eyes, which those are 11s, and we'll talk about Botox or your neurotoxins later. But then the next place that people look is around their mouth. And so we want to do things for them that kind of help replace that volume. So we can sometimes build a little bridge underneath here where we're adding just little bits of filler kind of underneath here. We're not adding like a ton of volume, we're just adding structure. So if you think about that, our lines in our lips kind of come down this way. If we add a little structure underneath, that line actually stops coming down. So those lipstick lines, right? Everyone puts the lipstick on as they get into their 30s and into their 40s, and they start to feel like they have smoker lines. Dermal filler is what we use to actually kind of lift that back up and give it the support. So when you're thinking about dermal fillers, people get almost like hesitant and scared. I would say I don't have one person that has sat in my chair for the first time and not been super nervous about getting kind of anything done. So it's unknown territory. So if we start off a little bit lighter, a lot of times people are, I would say, underwhelmed when we're doing a syringe here or there, but it's kind of building that base. So I always tell patients it might take 3 months, it might take 6 months, it might take a year to kind of get you back to where you were, kind of what's good for you. And when you look in the mirror and you're like, okay, Leslie, yep, I know that I like how I look right now. So then we try to maintain that. So a lot of times people ask, like, how long do dermal fillers last? Depends on the filler. So we have some fillers that are about 9 to 12 months, which I would say more is like your lip filler or kind of around the mouth. And then anything up to like 2 years, which would be your cheek filler. And we really appreciate kind of each thing individually, right? Because you have something that you don't like about your face. I have something that I don't like about my face. And how do we kind of collectively figure out what are the best things that will make you feel, like when you look in the mirror that you look really good. So I think it's really important to kind of sit with your injector or your provider and say, okay, these are the things that are bothering me, and then take a picture and kind of reflect back on that photo and say, okay, these are the things that we can help, and these are the things that we can't. And then we kind of treat based on that. The other thing that I recommend for patients that are considering dermal filler is to look at their parents. Or if you're not adopted, and this is something that I always bring up in practice because there are, a lot of people that are adopted, and so they don't necessarily know what they're gonna look like. So that is a little bit harder. But we all know, if we're not adopted, how we're gonna age, whether it's our aunts, our moms, our dads, grandparents. So we know, are we gonna get the jowls? Are we gonna get the nasolabial folds? Are we gonna have forehead lines? What's our neck gonna look like? We know exactly how we're gonna age. And then that's how I like to say, we're gonna do fillers with intention. We're gonna say, okay, this is one thing that I really don't like about, my mom. My mom is beautiful, right? Or your mom is beautiful, your dad is handsome, whatever that is. And it's not to say it's something wrong, it's just maybe that's something that I would prefer to like prevent from happening. Well, fillers can actually help us do that. And so that's why it's important to do it with intention. Like, this is the thing that's bugging me. Here are the things that we can do about it. And then kind of laying out a plan. So then you don't really look like you have anything done. So typically patients will come in and we'll sit down, we'll kind of talk about it, we'll talk pricing, what makes the most sense. Usually if patients are coming in for the very first time, I am pretty conservative. And I do that because I want to make sure that people are comfortable with dermal fillers, right? Like maybe you want to get your hair lighter and you just want to do a few highlights versus like going all the way, lighter. So it's kind of a way to kind of graduate into, getting something done. So when you come in, you'll sit, we'll do photos, and then we'll kind of talk through what that looks like. A lot of times I like to support the cheek first. So that might be a half a syringe over here, a half a syringe over on the other side. Typically most patients need probably one per side, but I'm happy to start out however somebody is comfortable, because as long as they know the expectation that it's gonna take maybe a few treatments to get to where they want to be, I don't know what their perspective is, right? Like you might think that one syringe is perfectly amount for you and that's all you want to do, and that's great. Or you might come back in 3 months and be like, I feel like I need a little bit more. Okay, great. We kind of let you, do what you want to do. We schedule about 30 minutes for filler appointments. Sometimes it'll be 45 to an hour depending on how many syringes we do, but typically I would say most providers schedule about 30 minutes. Now it doesn't take 30 minutes to inject. So you're coming in, we're taking pictures, we're gonna have you sign a consent form, and we're gonna talk through the whole process. Now for me, all of the fillers that I use have a little bit of lidocaine in them, which means that, they're gonna be a little bit more comfortable. So, but that still means you're gonna feel the poke. So typically what I'll do is I'll have you put ice whichever area we're using, and I use ice that's really cold. Somewhat uncomfortable for some patients, but it helps with the poke, and it also helps vasoconstrict the vessels so that it helps with the chances of bruising. So when we're using dermal fillers, we're thinking we might get a bruise, like that is something that people get a little bit uncomfortable with, right? It's not as fast as you would be doing a toxin. So the ice helps. Then post-treatment, we say, okay, like we don't want you to work out for 24 hours. We don't want you to go into a sauna. We don't want you to put makeup on. We want that area to be clean because we just, put needles into your face, which means that you are vulnerable to possibly an infection. Now that's really, really rare, but we don't want you to go use your dirty makeup brushes. And then I would say placing that ice on, we're sending you home with it. That also helps kind of put the bruises down. One of the other things that I do during treatments is, which I feel like people get a little bit more maybe worried about, is I hold pressure. So no matter where I'm injecting, like let's say I put a little injection here, I will hold pressure right after. If I feel a little bruise coming on, because you can see, maybe it bleeds a little bit more, maybe you can just see it swell a little bit more, I'll hold pressure. So holding pressure actually negates the bruise from getting bigger. So the longer I hold pressure, the better it is for you. So I say, like, there's nothing wrong, it's nothing to worry about, it's just I'm holding pressure to help you so that your bruise doesn't last very long and doesn't get very big, because if I'm holding pressure on here, the bruise can't get larger. So that's just something like a side note with fillers or dermal fillers that, I think about. The other thing that patients sometimes will use afterwards is called arnica, which is just a gel. You can use it 5 days prior to your treatment, which will help with the bruising. You can actually take arnica orally as well, which is something you can just get at like a pharmacy. And then you can also use that post-care. So arnica is a good one for bruising. Vitamin K serum is a really good one for bruising. Some people will take bromelain or eat a lot of pineapple. Like there's certain things that can help with bruising to kind of make it so it's not so much. But typically with fillers, it's just one of those things like you're probably gonna get a bruise. And then I would say it can take up to 4 weeks to fully settle. So, you might get a bruise on one side and not the other side, and then you might look a little asymmetrical. That's a potential. We do try to point out any asymmetries prior to treatment so you kind of know what is to be expected. But if you do get a bruise, you could swell more like on one side of the lip than the other. And then, people kind of freak out and they're like, oh my gosh, it's uneven. And it's like, nope, that bruise is creating a little bit of swelling. So therefore it might look uneven until the bruising has subsided. So typically we won't do any adjustments to any kind of filler for about 4 weeks usually. And by most of the time, it's all resolved. It's all resolved. And so I think that's just something to kind of keep into the back of your mind. Swelling is the other thing with filler. Cheeks, maybe not as much. Nasolabial folds, maybe not as much, but lips, every single time. You will feel like you look like a duck for about 3 to 4 hours. Again, remember we said we put lidocaine in there. So the lidocaine, if you've ever had any dental work done, kind of can make you feel like you have a fat lip. That's really what you feel like. You literally feel like you're like walking around looking like a duck for about 3 to 4 hours. Then it subsides, and the filler in the cheeks or in the nasolabial folds is really good because it kind of helps it feel good for like a little while. But your cheeks at that night will be sore because we've just placed some filler there, sometimes nasolabial folds. Lips, once the numbing wears off, they're tender to the touch. So that's something to like, you know, not be concerned necessarily about. If you have extreme pain, then we want to know about it. But swelling is kind of one of those things. I would say 3 to 5 days is typical for the swelling, especially in the lips. Like you might wake up the next morning and be like, oh crap, I look swollen. So usually what I'll tell patients there, my little trick is to just put a little foundation on the lips because that seems to dim it down and then you can gloss over it. But I think it's just really important to kind of know what to expect with fillers or anything that you're doing to your face. So if you have an expectation, then it is not a complication. So therefore, I try to be very transparent with patients of, all right, you know, like I work, you know, Monday to Friday. So if somebody comes in on a Tuesday, I'm like, what are you doing this week? What do you have planned? Do you have meetings? Are you meeting with your in-laws? Are you going on a date with your husband? Like, what are your plans this week? And then the question is, are you okay if you get a bruise? If you are, fantastic, we're gonna move forward with a filler. If you're like, nope, I don't feel comfortable possibly getting a bruise, I'm not gonna treat you. So I think that that's important. There might be some providers who are like, oh yeah, it's no big deal. It might not be. It might not be a big deal. But if I'm the one that gives you a bruise and you're supposed to go somewhere, now I made you self-conscious. And the goal with fillers, with dermal fillers or any kind of aesthetic treatment is to actually make you feel more confident. So it's just being mindful of the different things that can happen. Do they always happen? No. Does somebody always get a bruise? No. But you could have gotten filler 5 times in the past and not gotten a bruise, and then the 6th time you get a bruise. I just want to make sure that you're aware that you could get that bruise because I don't want to be responsible for you not being able to do something. So I think it's just important to kind of understand, you know, the ins and the outs of filler, kind of post-treatment, pre-treatment, kind of what to expect. And I think if you ever feel pressure or I should do more, then maybe that's not the right provider. But the goal is to kind of take your prettiness or your beauty and kind of keep it that way. We don't want you to look like everyone else. I want to take, you know, whether you're 30, 40, 70 and kind of say, okay, what do you want to look like? What is it that you're trying to achieve? Is it just that you don't look angry? Is it that you don't look, you know, tired? So dermal fillers are just meant to kind of soften everything, make you look more refreshed. Sometimes they can, you know, build that support, and we just kind of use them to kind of enhance your beauty. And so what I would say with dermal fillers is to really use them with intention and make sure that when you're doing it, you kind of know what the end goal is, whether that takes 1 treatment or 2 treatments. But at the end of the day, it's your choice, and we really want to help you age gracefully with intention so that when you look in the mirror and you wake up in the morning, you just feel your best self.